Hi, and welcome to Tharaka Foundation's YouTube channel, Supporting the Whole Child. We just wanted to give you a quick disclaimer saying that everything that is found on our YouTube channel is created for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something that you have heard or seen on this YouTube channel. Thank you so much, and without further ado, let's begin today's video.
Welcome to the Tharaka Foundation YouTube channel, Supporting the Whole Child. I'm your host, Poonam Nagpal. I do have Dr. Leena Kanzode with me. And if you remember, we were talking about social anxiety in our last episode. I would like to know more about it. So Dr. Leena, do share with us more about what is social anxiety and what parents need to watch and what can they do to help their child.
Thank you for having me again. So social anxiety is another form of anxiety that can be there normally. So again, it's the same kind of understanding about anxiety that, it can be normal in certain range, and when it goes beyond that range, it starts to kind of backfire or starts to cause problems. So the same thing would apply for social anxiety. So as the term says, social anxiety is nothing but you are anxious about being in social situations. And the social situation can vary from person to person, right? So for some, it could be I'm anxious only when I meet new people. For some, it could be I am anxious with my close friends when I meet with them. For some, it could be I'm anxious only with adults when I meet with them. So it's a very different experience for each person. So in general, the person who experiences anxiety in social situations feels that they are being watched closely or monitored closely, or every move of theirs is being looked at and they are being judged in some ways. How they say, what they say is also being kind of monitored and judged. So, in some sense, like, we can say, we've used the term, I get conscious when I meet some people, or I get conscious in front of a big crowd when I have to speak. So that's, what it is. Basically, you're more conscious, more aware of, how you are looking, how you are presenting, what you're saying. And then, but the layer of anxiety that kind of takes over is that it actually makes you feel that you're not doing something right. So it's not about just also being conscious or aware of every move or everything you're saying or doing, but it also then there is a judgment factor that you yourself have. And then you feel that that's the same way others are perceiving you. So that's when I think it starts to become a negative experience. So having a little bit of for some people who are introverts and shy, feeling little socially anxious to meet new people, or, go to the first day of school, or present in front of the class, or perform, whether it's a game or a show or whatever they are involved in, all of those things can trigger some level of that anxiety. But when it is predominantly, about, how I am being perceived and how others are judging me, and maybe they are not liking me, maybe I'll get rejected, maybe I won't be accepted, is what actually is the issue with this problem. So usually what we say is that, as long as, again, it's not severe enough where the person is now actually starting to avoid going to social situations. They are actually getting concerned about, if I go there, they will ridicule me, they'll not accept me, I won't be, part of the group. And so instead of going through that much turmoil and anxiety and distress, I rather not go. So avoidance of the social situation is one main hallmark of that it's starting to become a disorder at this point, from going from that normal level of social anxiety to now becoming a social anxiety disorder. In olden days, we used to also call it social phobia. Just like, it just becomes it's a phobic stimulus, like going to, any kind of bigger social or even a smaller social event that I am feeling like I would be judged or I would not be accepted or I would be avoided. That's, what becomes like this big trigger for feeling that level of fear. And so you don't go. And so that's, again, for parents who are listening to us, I think it's important to keep an eye on when your child starts to avoid going to places and situations. And if it's like one particular thing that, I don't like to go, hang out with my soccer team, that's not a red flag. But if it's like, I'm avoiding, not only going to my soccer team, but my great group of friends that I used to go and participate in birthday parties and other things like that, if there is avoidance that's starting to generalize and they are missing events and they're not participating because, they are feeling very anxious, then that is a thing to start being very aware of and getting them help. And the first step could be to ask them about what it is and understand their thoughts about why they are not going.
Dr. Leena, very interesting learning for me. When you were talking, a lot of questions came to my mind. So I wanted to ask you a few questions. Like we talked about, child could be introvert, could be shy, but can a child have body image issue and may not like to mingle with others because, as you said, the child is cooking in his head, that perception is there, whether it's real or not. But for that child, it's pretty much real. So I was wondering if a body image can also be a cause of avoiding that social interactions with friends or, big gatherings.
That's a very good point you're bringing up, Poonam. So yes, that could be often a very big factor, particularly in today's world where social media has really raised a lot of importance around our body image, particularly for teens who are trying to fit in and trying to find a place. And they are going through this classic identity formation phase of their life. They are very focused on how they look and, what they wear and how they are in comparison to other people who they are going to mingle. And so, that can be potentially a very big reason why people may choose to not go, because they may get concerned about people looking at them in a certain way or commenting on their body or how they are looking, and that could be very anxiety-inducing for them. So, it could be, different reasons. For some, it's the body image. For some, it is how I look, how tall I am, how my skin color is. There can be a lot of factors like that. Or sometimes it may be not so much related to appearance, but it's about just difference in opinions and thinking, and people may feel like, their opinion is not valued, or, they may be internalize it that, last time I was sharing my opinion about this, I wasn't receiving a lot of feedback or discussion. That means they don't like me. So there is a lot of misinterpretation or misperception that anxiety actually brings, and that's how it thrives. So we understand that anxiety actually distorts your thinking pattern. So as it's starting to grow, it starts to skew your thinking. It starts to make you think the worst possible. It may start to make you think about negative, or and then after a while, after doing it enough times, you start actually believing in what you're thinking. And so this is kind of another thing to keep an eye on, to see if you're internal dialogue is telling you, those thoughts are telling you, hey, you don't look pretty today, you better not go to that party, everybody's going to like make fun of you, of what you're wearing or whatever, to kind of look at that thought from an objective way. And it's hard for kids to realize it's not my thought, it's the anxiety putting this thought in my head. So one of the work we do to help kids kind of battle this, if you will, call this anxiety disorder or any kind of anxiety disorder for that matter, we externalize the problem and we help them understand that you are not thinking this way. It's the anxiety that's making you think this way. So let's first figure out whatever they are telling you to, think and believe. Is that something you truly believe? So you kind of become detectives of your thoughts and you look for what's the evidence for believing in this thought and what's the evidence against believing in this thought. Externalizing the problem can be very empowering. And I give a common example of, when I'm sick because of a virus or a bacteria, the virus or the bacteria is attacking my immune system, which is producing symptoms of cold, cough, fever, chest pain, whatever, those things. So similarly, when this bug of anxiety, is attacking my mind system, my thinking system, it starts to actually thrive by changing my thinking patterns. And so I start to think differently. I start to have what we call as distorted patterns of thinking, or, we use the term, it's a negative trap, or you're getting trapped in your own thoughts. And so that's the manifestation of anxiety, the way you're thinking. And then we also understand the way we think affects the way we feel, and the way we feel affects the way we behave. So this is really proven scientifically. There is, in fact, a therapy that's based on this construct of thought, feeling, behavior that's called cognitive behavioral therapy, which is basically a very strong evidence-based therapy that's used to treat all kinds of anxiety disorders, including social anxiety disorder. So when we tell the teen that it's not you who is, having this problem, it's the anxiety making you think this way and have this problem. And so, you kind of externalize it. It's just like, okay, I'm sick, so I need to sleep well, rest up, eat well, take time to recover. So it's kind of the same thing. So I'm fighting against the virus by doing all the good self-care things. Similarly, once you're able to externalize the problem that it's an anxiety disorder that's attacking my thinking and making me behave a certain way, I can find ways to then fight against that anxiety by using the cognitive behavioral therapy skills. And so, that's kind of what, we do. I think I gave you a very long answer.
No, Dr. Leena, it's very interesting, even though we are talking about the whole child and anxiety in teens. But I will tell you my experience. I just spoke with an adult, 27-year-old, but she was sharing the similar experience what you just shared. She also felt like there was a bug in her head making that negative voices, and she was not feeling like getting up and going to the meeting and sharing her status. So I was asking her, like, were you like that before, or what happened suddenly? And she was thinking she's an imposter, she's not good looking, and she was hating her hair. And then we talked, and she told me the cause was, like, we were talking about social media. So she decided to boycott social media for a while. And then she did cut her hair, and she felt that young person again. And I think she did few more things she was sharing with me. So I felt listening to you. It's not like only teens or children, young, even adults that like we do get that bug, right? We do have that doubts
Absolutely.
on ourselves, right? Right. So very
Yeah, it's
interesting.
like,
Did you
it's no one is immune to these things, just like we get other illnesses and other things that make us sick. This is another thing that can happen to us. But the good news is
right?
if you are educated, just like how now with current pandemic, we are being, more educated about as we are learning more about this virus, and we've been following the practices to prevent that infection from happening to us, and measures to take. The same thing, if you do a good job monitoring your thoughts, if you are taking good self-care, also taking care of your mind in addition to taking care of your body, then you can prevent from, like we have talked about, from developing an anxiety disorder.
Right. And I think that listening ears, like, yeah, if you need to take help, definitely. That's what my recommendation to her was. I did provide that listening ears. She wanted some validation. So I did that, but even I suggested, if nothing is helping her, she shouldn't be shy to go to a therapist and do the right things, because the way she was explaining to me, it seemed like it was impacting her sleep, it was impacting her performance at work. So I do not think we should go that far. So preventive action, as you said, watch your thoughts, do that meditation, even breathing exercises. So they will help you. But if it is getting worse, I do not think we should be shy to go to a therapist or other mental health providers. So anything else, Dr. Lena, would you like to discuss about social anxiety today?
Yeah, so I would absolutely second what you're saying, and it's heartwarming to hear that a person, like you, who's in IT world, has been making this recommendation that, it's okay and it's important to get help, and even seeing a mental health professional sometimes is a good idea. Because we are trained, we will be able to help you in a way that your friend or somebody else may not be. If, again, it's not that I don't want you to, you should, of course, share and talk, and often people, in your life can help you somewhat, but if it's particularly starting to affect your day-to-day functioning and well-being, then it's time to definitely reach out to a mental health professional. One last thing I would like to add or talk a little bit about is another strategy that we use to treat social anxiety disorder. And so because avoidance is such a big kind of, hallmark of diagnosing this problem, so if anxiety is high enough that you're avoiding things, often we get patients where they have now been avoiding things for a while, and now they are super scared to go back to whatever the stimulus is, right? And so what we usually do in those situations is, along with the cognitive behavioral techniques I mentioned briefly, we also kind of use this mantra of face the fear to fight the fear. So it's kind of it's almost counterintuitive when I say that to the kid that, I want you to, you're scared of going to that party, I want you to actually go. And they'll be like, what? Like, are you crazy? And I help them understand that, our brain can build a lot of wrong associations over time with certain like experiences or stimulus or how we think. So we need to reprogram that, and we need to actually face that fear. And the idea is to basically expose yourself to whatever you're scared of. And of course, it's done in a very gradual, graded manner. So I don't like tell them, okay, you're scared of seeing that couple friends of yours. I want you to go to the party tonight. We don't like make that recommendation in the first session. But as we are working through and educating and giving them more tools to manage their anxiety, we create a little hierarchy of like plan, like a little step-by-step gradual desensitization plan of how that's going to happen. So it can even like start with small role plays in our session to even walking out and practicing in some of the real world situations. Like some of my patients have anxiety about talking to strangers when they go to stores or ordering their food in a restaurant, because it's like, I have this completely strange person I have to talk to now. So we also take stepwise, approach to, playing role play. Okay, I am the waiter, you're placing an order with me, to actually sometimes even going to a cafe and practicing there. And the idea is to, we know when you are in the midst of that fearful situation, your anxiety is going to rise. So we are also then teaching them how they can bring that anxiety thermometer from going from 1 to 10 to catch it when it's rising from 1 to 5 level, and deep breathing and using some of the cognitive techniques to really bring that down. And more often than not, people realize that, yes, the first 2-3 times they are exposed to the fearful stimulus, their anxiety does go up. It may be uncomfortable, but they are surprised to find out that if you face that for a few more seconds or minutes, your anxiety actually comes down, whether or not sometimes even you practice those breathing techniques. So we know that anxiety comes like a wave. Whether or not we do anything about it, it almost always fades away on its own. Sometimes it may take longer. That's why we want you to use skills to bring it down. So we, do that graded, like, okay, now let's do it at this setting, and then we send them to the main setting. And so they are empowered, and they have now learned that, oh, it's more in my head that it's so scary, but it actually is not so scary. So that's the learning we are trying to instill. And that's a very powerful method that can be used to treat this. So for parents, if you're already seeing some of the things being avoided by your child, if you're noticing some here and there, encourage them to even go for the first 5-10 minutes if they don't want to stay for the whole thing and come back. Or participate in something, or like talk to the teacher and modify the setting and have them do it in a way where it is not as intimidating. So if it's like I have to present in front of 20 kids in my class, that's too anxiety inducing. Okay, maybe we could tell the teacher to have a separate time with a smaller group and just her or him, and you present there. So again, it's like you face the fear to fight the fear, and it's a gradual desensitization method, and you're using the CBT skills, and you are able to overcome this problem.
So, Dr. Leena, I wanted to ask you one question. So, is it possible, like, child is having social anxiety with one set of people or friends and not with the other set? Mm-hmm. Is it possible?
Absolutely. So, like I said, they may be fine with their comfortable group, whether it is a group from school or a neighborhood friend group or another activity friend group. But if you tell them to hang out with your friends' kids, for instance, like, oh, we are meeting with this family, why don't you hang out and talk to them? They may be feeling awkward or shy or anxious about that. Or it might be they're fine with their peers, but when it comes to talking to adults, they get, anxious about that. So it's very different. Just like, how people can worry about different things. This is the same thing. They can worry about something that might seem trivial to you, but that's a big deal for them. So again, it's important for parents to validate that and not dismiss that, and never say that, oh, if I can do this and your dad can do this, why can't you do this, right? I think there is generally a tendency, but you have to understand if the child is avoiding or they are in distress, you need to sit down and understand and look at this from their perspective, kind of go into their shoes and be empathetic to understand what this is for them, what can we do to make this experience positive slowly.
Yep, so I will tell you a quick story, Dr. Lena. So my son, he's part of Boy Scout and he had to host a Zoom meeting and he was a little bit nervous, but he had to invite adults also as per the Boy Scout rule. So he was asking me, how do I kickstart the meeting? Can you tell me a few social small talks that I can make? So I did give him few tips and he did an amazing job. And I was invited to that meeting and I did make few connections and I did do kind of role modeling. And at the end of the meeting, we kind of talked. Like I asked my son, was it difficult? How did you feel? And he was so happy. Like he could talk nicely. He made more connection. And it was just, he had those fears in his mind. So I was so happy, as a parent, I could support him. I could role model for him. So I'm hoping, the next meeting he will host, he will be all fine. But as you suggested, face your fears, go for it, try it. And I love that Nike model. Just do it. What will worst happen, right?
Right. Exactly. No, that's great. I'm glad that you were able to help him out. That's what you need. You need to take time to listen to them, what's bothering them, and then you can help them problem solve.
Okay, awesome. And I really loved your idea of externalize the issue. It's not the issue with the child or, when you're explaining, it's okay, it happens, right? So it is kind of a bug. So as you said, as a parent, I can be providing listening ear, be supportive. And if I see, my child performance is impacted, I should be open-minded to take it to the next level, seeing a health provider, right? Mental health provider, whether it's therapist or, psychiatrist. I'm very thankful to you for educating us on these issues, and I'm sure with pandemic, I do not know if you're seeing more issues of such things, but I do feel as being IT professional, we are all the time on the laptop attending virtual meetings, and we do not know how it will feel again when we see each other in person.
So true. Yep. And so I think that's, this environment is brewing more social anxiety. It's building up. So that's why it's important to, tackle that now in whichever shape or form you can. But we are also concerned that some of our socially anxious kids that we had made a lot of progress with might be getting worse after the pandemic.
We will take more preventive actions and we will stay connected with you to learn more. Thank you so much.
Thank you so much.